Hey there, it's Dr. Andrews, and this is our inaugural podcast. We're super excited to start this podcast. We are going to explore some really, we think, things that our patients want to learn about. We're going to talk about procedures. We're going to talk about some of the services that we provide. And today, we're going to start with our wonderful nurse practitioner, who we're going to learn about just her life, her history, but she has really come through some tough things in life and has persevered. And we're going to learn a little bit about that, her upbringing, and some of the things that could have contributed to some of the situations that she found herself in. And it really is a story of, like I say, perseverance, fortitude, and she's now a wonderful nurse practitioner in our practice. So welcome, Kaitlyn Wheelan. So Kaitlyn, I met you, I think back in 2016 or so. Mm-hmm. We met professionally, and she continued with us, seeing Courtney, our PA, and I was immediately moved by your story. I came to learn more about some of the things that you have struggled with as time went on, and I thought it'd be important and instructive and really helpful for other patients to learn about some of the things that you have struggled with over your life, and how it has helped you help other people. That really is the important thing, and I think that's one of the reasons you became a nurse practitioner, so that you could help other folks. So tell us a little bit about where you're from and some of the things that you dealt with in high school.
Yeah. So I'm from a small town in southwest Iowa, outside of Omaha, Council Bluffs area. My dad's a farmer. My mom was a nurse for 40 years. And so throughout my life, I had always been overweight, I would say even from 5th grade and up. And so I, had some bullying and things like that made my life more difficult at that time. And then in 2007, I decided I wanted to change my life and my lifestyle and everything. And my mom and I both embarked on a journey to lose over 100 pounds. She lost 100, I lost around 120. And that's why I love doing what I do today, because it's quite the journey.
It's amazing. I actually just got goosebumps just thinking about, your journey and losing 120 pounds and some of the things that you probably dealt with. In high school, because kids aren't, sometimes great in, how they interact with other folks. How do you think that affected your self-esteem and that sort of thing?
Yeah, I feel like I obviously went through some hard times, but I had older siblings who were kind of helping me through it too. But, definitely had low self-esteem and kind of just was looking for love in all the wrong places type stuff, and acceptance from friends and men and all these things. And it was just really interesting to be kind of at a low point in life, and then decide to make a change. It's really empowering. Yep.
Now, the story about you and your sister was quite remarkable. You guys are, hard chargers and have been very successful. Tell us a little bit about your sister.
So my sister is, she's like a bulldog, right? She's very powerful and very smart. She's an interventional cardiologist. And so she, being the older one, was just always, wanted me to be more, and be better, and do all these things. And so now I think I make her proud.
Right.
But, there was times that certainly I wanted to be just like her and couldn't be. But yeah, she's very fit. She has been her whole life. So there's some differences growing up and things like that. But
So you lost 120 pounds, senior in high school, went to college.
Yep.
In Omaha. And decided to become a nurse.
Yep. So I did 3 years, just kind of college life. Thought maybe I should start to get serious. My mom kept telling me, just be a nurse. You'll make some money. Just do that. So finally, I agreed with what she said, and I became a nurse. And then when I graduated in December, and my sister said, you should come here. And then I moved to Iowa City. And
your sister was at Iowa at the time.
Yep, doing her residency and fellowship at Iowa, and I moved here and worked at Iowa for 4 years.
Now, before you moved here, you were married back in your hometown. Is that right?
Yeah.
So Tell us about that and why you think you got married at 19 and that sort of thing.
Yeah, so I got married at 19 for a few short months, but I think, it was just me. Like, I had lost the weight, and I was really looking for acceptance from people to like me as I was. And it's kind of a low self-esteem era that you try to get out of. But, I got married and realized, like, I want to be so much more than this. Like, I looked different, but I also needed to live better, like my mindset, my everything.
Feel different.
So that's when I really got into the lifestyle changes and health and fitness and journey on myself.
Your weight loss journey did have some hiccups as well, though, right?
Yes.
Right. So you lost 120 pounds, but I think the pendulum swung a little bit too far at one point as well, right?
Yeah. So I struggled with anorexia, and then that led to bulimia, and then a little binge eating, and then I remember a point being feeling a little bit out of control with things, because I think a lot of eating disorders are about control. And so at that point, I got therapy. And I decided to make my control about me and what I can control. And that's when I got into health and fitness and things like that.
Right. So, unfortunately, had a divorce, moved to Iowa, started working as a nurse at the University of Iowa, and then took a job at Mercy, and that's when we met.
Yes.
And so we met professionally. You came to see me for a breast augmentation. Why did you want to have a breast augmentation?
I had always thought about having a breast augmentation after I lost the weight, but I just felt in my heart that it could make me feel more feminine and just more attractive also. So I'd wanted it for a long time, and then, found you, and it really did change my life, and how I felt, my self-esteem, the way I looked, and professionally, I think too, just being in fitness and being able to portray yourself in a more fit way with,
You got married. You married Brad Wheelan. Tell me a little bit about Brad. What did he think about you having a breast augmentation?
Yeah, he, of course, said that he liked the way I was and everything, but it was so important to me that he supported it. And we did it shortly after we got married, and it's the best.
Yeah. Very good. So, interestingly, after you went through all of your weight loss, your anorexia, bulimia, sort of eating disorder issue, you came through it. You were stronger, right? And you wanted to help other people. So tell us about that. So when you were a nurse, you started coaching folks, helping them with their journey. So tell us about that.
Yeah, so throughout being a nurse, I got really into nutrition and things like that. Of course, learned about it in school a little bit. But then as I went through this journey of the losing weight and then the eating disorder phase, I just really wanted to empower women, right? And so many people go through what I went through, and it's just, really empowering to help other women and men too. But I started posting on Instagram and got a little following, and then I joined a little team called Soul Fit Sisters, and we helped coach women through mostly lifestyle change, work out a little bit, but it's really empowering. And I think that women feel alone, and men too, but it was really empowering.
No, that's great. So you used social media, right? You had the confidence to do that, number one, right? To post, images of yourself, videos. And I would imagine that resonated with a lot of women.
Yes.
And so then people started calling you or reaching out to you and say, hey, can you help me with macros? So what are some of the things that people wanted help with?
So I feel like I mostly focused on nutrition, but I did get into the working out a little bit later, but we were counting macros and calories and things like that, and I was super into helping people decide it based on their resting metabolic rate. It got pretty detailed,
pretty scientific.
And I really enjoyed that part of it, and I always knew I wanted to do something like this in the future, just didn't know in what capacity. And
so it's kind of come full circle, because you're a excellent aesthetic care provider, so not just weight loss, but now in fillers, Botox, BioT, lasers, exactly, and really helping people become more confident. You have a unique perspective because of the weight loss, but also you've had plastic surgery, right?
Yes.
And you've had fillers and Botox and that kind of thing, and really can help people, kind of navigate, these transitions that people go through with life change, getting older, and that sort of thing. So Courtney is our PA, and after you had your breast augmentation, you continued with us doing, Botox, filler, and that kind of thing. And then Courtney said, "Hey, remember Kaitlyn?" And I said, "Yes." And I think she was mostly seeing you up in our Cedar Rapids office, so I didn't see you much. She said, "Yeah, she's finishing her nurse practitioner degree." And I was like, "Oh, wow." And she had this great idea that we could bring you on to help start a medical weight loss practice and ultimately do other things. So tell us about that. So you came and graced us with working here. And so we started Elite Living Weight Loss. And so talk to us a little bit about that.
So originally we started the weight loss here, and it was more phentermine based lifestyle changes, minimal support with medication, but and then we got this nurse, Jamie, who we all love. She told me about this thing called semaglutide, and I thought she was kind of crazy, but I was like, this is great. But we looked into it a little further, and it's just this booming business right now. It's actually life-changing medicine, which is really great, and I think the program here is like exploded. I mean,
so what's interesting? Cool. What's interesting is I just saw a woman who is not treated in our program, but she's actually a massive weight loss patient. 268, now 150.
Oof.
268, awesome. Now 150 on Mounjaro, right? So now plastic surgeons are seeing massive weight loss patients who are doing it pharmacologically, not surgically, right? I mean, I literally just saw her today, right? And she came to see us for basically a mommy makeover type procedure. So these medications have really been life-changing. Now, you were changing lives before with your program with macros and working out and becoming, more fit from sort of a combination. But this is really getting people over the hump, because I'm sure a lot of those people that you were working with had tried 5, 6, 7 different weight loss regimens. She actually said that she was doing the coffee. There was some coffee. Yeah, there was some weight loss coffee. And she said she lost 60 pounds, but she gained it back.
Yeah.
With Mounjaro, she's been able to sustain it. So tell us a little bit about what some of these, sort of the science behind some of these weight loss drugs.
So originally was just semaglutide, which is Ozempic, Wegovy, and there's also Saxenda, which is a GLP-1. That's a daily one, but these are medications that are created to improve your insulin sensitivity. Right? They wanted to find a way to improve people's insulin sensitivity without giving them exogenous insulin.
Yeah, exactly.
Right? So we know now that when you improve people's insulin sensitivity, the metabolism of fat and proteins is improved.
Right.
And that means the metabolism in basically every cell.
Yeah.
Right. So we know it can reverse fatty liver, high blood pressure, high cholesterol. Reduces cardiovascular risk. So they're really cool.
Yeah.
Yes, you will lose weight.
Yeah.
But you'll be doing yourself a favor by becoming the healthiest version
medically, physiologically.
of you. Yes.
Exactly. So these GLP-1 agonists are interesting in the sense that, and I've learned a lot from you about these, they're interesting in the sense that they're a part of glucose homeostasis, yes, for sure.
Yes.
Right? But they are also hormones that affect satiety.
Yes,
right?
Yes.
That affect gastric emptying, that affect GI motility, right? And all of those help us in terms of feeling full, right? In not craving as much. Talk to us a little about the craving, and because you're being a little bit adventurous in helping people with smoking cessation, with bulimia. Tell us a little bit about that, because these medications are really remarkable because there are some effects on our brains as well.
I think it makes more sense when you think about it. For instance, tirzepatide, which is the most novel one, right? It's a dual receptor agonist, GLP-1 and GIP. These are incretin hormones, right? Incretin stimulates your body to release insulin. Okay. When insulin and glucose are well controlled, you don't have increased like spikes and cravings all the time, right? High ups and downs with your glucose.
For sure.
You have this tight control. Should maintain
better
your
homeostasis,
cravings.
basically. Yes. Yeah.
And so it also has, to do with the part in your brain, right? Where you're not having these intense cravings. And in my opinion, food is typically some sort of addiction problem.
Yep.
And so we are using it off label for weight.
Right.
Well, weight loss is off
Right,
label.
right.
Smoking cessation
Right.
and a little bit of bulimia.
Right. So it likely affects some of the neurotransmitters in the brain, right? That give us some of these cravings that sometimes can be a little bit self-destructive, like overeating, smoking, drinking, bulimia.
Yep.
And so it's actually remarkable. So we're really learning. Now, these medications, a lot of people ask about, are they safe?
Yep.
Right? And as I've learned from you and learning more about these medications, these basically are supercharging hormones that we already have.
Yes.
Right? So it's not a small particle, right, that some other medications are
Right.
that are, binding to receptors and doing things in our bodies
Yeah.
that are unnatural.
Right.
This is
right.
a natural homeostatic process that we're just supercharging, right? For some people, they might not be getting enough GLP stimulation when they eat, because GLP
Yes.
is made by the gut, and when we eat, so it's a natural hormone that we
Yep.
produce, but they're just getting a little bit more, maybe just to get them over the hump. Is that
Right, of
what
course,
you've
yeah.
experienced?
And so as you age, all of your hormones decrease.
Correct.
And insulin is not exempt.
Correct.
Right?
Correct.
We have human bodies really smart.
Right.
It'll protect you from getting diabetes.
For sure.
Type 2.
Yeah.
But it's not going to work sensitively enough for you to lose weight.
Very
and that's
good.
why a lot of
Yes.
premenopausal, postmenopausal women
Yeah.
are really
Yeah.
honing in on this, because
Yeah.
it's you give yourself a shot once a week. It tells
Yeah.
your body's own insulin
Exactly.
to work.
There you go. And so people do ask, is this safe? Number one,
Safety,
right?
yeah.
Yep.
It's got a great safety profile.
But these medications have been on the market for years and years, being used for diabetes, so they have a
Yes.
great safety track record. But now it's one of those serendipity situations where
Yeah.
people are losing weight, and we're using that side effect
Yeah.
for weight loss. And so it's been remarkable. So tell me how it works. So you come in and you
Yeah.
have to have a consult with you. and
Yeah,
that kind
make
of thing.
sure that your medical history is, not one that could be contraindicated with these.
What are
Like,
some of those contraindications?
the number one is if you've personally had a tumor, nodule, or cancer of your thyroid.
Gotcha.
I mean, and I say this too, if you've had nodules of your thyroid,
Yeah.
it may be more important for you to lose weight than worry about the 0.001 risk of getting a nodule.
Gotcha.
Right?
Gotcha.
Because the health benefits that come with the medication.
For sure.
But yes, have a consult, make sure you're a good fit for the program,
Yep.
and then we'll order the medication for you. It's prescription only, so
Okay.
you have to be monitored the whole time
Yep.
you're on it. Make sure that everything stays stable while you're on it. and
Yeah.
then-
So here at Dr. Andrews Plastic Surgery, we pride ourselves in not disparaging other providers, right? But things can be done differently,
Yes,
right? And
yes.
we've heard some stories where people are sort of getting it online, or people are getting it from a doctor who is not super involved with their patients. I think the beauty of our program is we've got someone who has lost weight the old-fashioned way,
Yeah.
number one, right? But who also is vigilant about determining who's a great candidate for the medication, monitoring. I mean, we also had a hormone sort of homeostasis practice as well. Talk
Yeah.
a little bit about BioT
Yeah.
and how that can dovetail with
Yeah.
this.
I think they go a lot together, because as you age, your testosterone level is going down, and it's like I said, insulin's not exempt, so people are having all these symptoms from low testosterone, fatigue, low sex drive, low muscle retention, memory fog, things like that, and then they can't lose weight.
Yeah.
Right? So they all go together. It's really cool.
Tell us about BioT. What exactly is
So
that?
BioT
what is that
is-
program that we have?
Yeah, so that's bioidentical hormone pelleting. So
yep.
they look like a little grain of rice, and that we insert them into the upper part of your hip.
Yep.
And they slow release over 3 to 4 months for
Do
women.
you have to get labs and that kind of thing?
Yep, get labs for both programs, weight
Yep.
loss and hormones.
Yep.
Just to make sure everything's looking good before we
Yep.
do it. I always tell people everything we do here is how you feel your best.
Yep.
So we will have recommendations on other vitamin levels and things like that.
Yep.
Thyroid levels and all that good stuff too.
We also here at the Recenter also offer IV therapy and,
Yep.
and multivitamins and that kind of thing, and NAD and other things. So, we think we provide a fairly holistic approach to managing the human body, managing aging and that sort of thing. So, Kaitlyn, this has been really instructive. I really appreciate that you were willing to share your
yeah.
story. And I think, your story is the story of many people, women, but men as well. Tell me about some of the men, just real quick. I mean, what kind of weight loss have we seen in some of the men?
I feel like we have a lot of male patients lately. We have 90 to 95 pound weight loss in 5 to 6 months for men.
Yeah.
I mean, it's certainly a bit more accelerated than females.
Yeah.
But overall, I mean, my husband lost 45 pounds with it. So, I mean, it's very successful, and their quality of life is so much better.
Absolutely. Well, thanks again for tuning in to our inaugural podcast. We're going to have many other podcasts. We're going to have some of my friends who are plastic surgeons around the country, so you can learn about plastic surgery in other places. We're going to have some industry folks on who can talk to us about some of the products and services that they offer. So again, thanks for tuning in. Again, thanks, Kaitlyn, for sharing your story. Stay tuned, and hopefully we'll provide other podcasts that you guys will find instructive and helpful.